73-year-old Helen has osteoarthritis. Her right knee has been getting progressively worse.
Walking is definitely a problem. It just gets very painful. I can't bend very far, and if I get on the ground I can't get up again without hanging on to something. Stairs are my worst thing, particularly going downstairs. I cannot walk downstairs properly.
Helen first saw an orthopaedic surgeon about 2 years ago and was advised to delay surgery by trying to lose some weight to reduce the load on her knee.
The weight loss definitely improved my symptoms.
Helen has also been doing water aerobics and seeing a physio to help strengthen her muscles and maintain mobility.
This year I have been exercising most mornings. That's the first thing I do when I get up.
But unfortunately, her symptoms have persisted.
My knee was locking and I was experiencing more pain than I had been.
Any locking, catching, clicking?
Definitely. If I cross either leg over after a while or have it straight like that, it'll lock.
You can see that on the outer aspect that there's a nice big space between the femur and the tibia, but on the inside here that there's no space.
So, together with her orthopaedic surgeon, Dr. Matt Lyons, Helen decided to have a total knee replacement.
It's certainly different from when I saw you 2 years ago, isn't it?
Helen, I've been seeing for a number of years now, and she's previously had a left total knee replacement with another surgeon who's subsequently retired, and so she's now at the stage with an arthritic knee that's exhausted non-operative treatment. She's an excellent surgical candidate.
Yes, I definitely said it was the right time. Needed to improve my way of life.
The knee replacement, what we do is we actually resurface the femur and the tibia. And we have multiple sizes of femoral components, so we can get the one that matches your size and shape, and we cement that into place. On the tibia, we make a cut which is parallel to the ground and perpendicular to the long axis there, and we have 10 sizes of base plates, so again we can find the one that matches your anatomy. Then into that base plate we put a plastic liner, and these come in 1 millimetre increments. So we've got 10 sizes of those, so we can get the one that makes sure that you come out nice and straight. So immediately after the surgery, when the anaesthetic's worn off, we'll get you up and you can put all your body weight on it.
My aim of surgery is to be able to walk longer and to be able to go up and down stairs and also to exercise. Also, I've got 5 grandchildren under 6, so there's a little one that needs carrying, and also another one who's trying to learn to ride a pedal bike, and the bikes live here, and I can't do some of that right now.
My expectation is Helen's outcome will be excellent. Her expectations marry up with what is achievable and what is plausible from a knee replacement.
I'm fairly excited.
All right, Helen, I'm just going to go through your admission this morning.
It's operation day, and after arriving at the hospital early, Helen is now being admitted and going through pre-op preparation.
Did you receive any blood transfusion with the loss here?
No. I've had a busy morning this morning. I've been up since 4 o'clock to get here. I'm feeling fine. I think my blood pressure's up a bit, so obviously I'm more stressed than I thought I was, but apart from that, I feel good. You got your licence? I'm well looked after, and I can't wait to wake up after the operation.
The fundamental aim of a knee replacement is to rid the patient of that arthritic process, to restore the functional balance of a knee joint, improve their range of motion and diminish their pain. And the sum total of that is that it restores their functional capacity and quality of life.
Dr. Lyons carefully removes damaged bone and cartilage in Helen's knee and replaces them with new smooth surfaces made of metal and plastic.
Went perfectly fine as expected. It takes about somewhere between 4 to 6 hours for the spinal anaesthetic to wear off. And once she has sensation and some movement in the feet, and we check that her blood pressure is okay when she stands up, and the physios will get her up, but definitely she'll get up today. It is important that she gets up and gets moving. There are important factors for her cardiovascular status. The risk of blood clot is diminished the earlier you move. And also just to give her that confidence while she has pain relief on board, that she knows that she can put all her body weight on the knee without having any issues.
When you take a big deep breath, it probably comes
Day 1 post-op. Helen's been busy.
I'm feeling very well today. I feel great. I didn't actually get up until about 4:30 yesterday afternoon with the physio, and I stood for a while and then I walked to the door and back with the walker. I'm about to get up and go with the physio for a bigger walk than just from here to the door.
So when we're up, you can put as much weight as you like through this knee, okay?
Yeah.
You're not on any weight bearing restrictions?
I'm very happy with the pain relief. And they're always asking you if you want pain relief. So basically I think I've probably had something every 2 hours.
Moving really well. We're going to head back in here.
Helen's pre-operation exercise program is proving to be hugely helpful at this stage.
So hands down onto the bed. That's it. Operated leg out.
She's finding it easier than when she had the left knee replacement 9 years ago.
I think I'm doing better than last time because I'm fitter. Even though I'm 9 years older, I've been exercising since all year, really.
So we achieve everything kind of on your journey before we get you home, or in your case rehab, okay?
I felt really good walking with the walker, and the physio was next to me. My knee definitely felt stable. It was a little bit more painful, but I'm told it always is on the first day when you go for a longer walk. But I managed it okay. Feels good now. I've sat down and my pain's actually gone right down. So that's gone wonderful.
Helen will leave hospital in 2 or 3 days.
So far, so good, yes. And I think, it's a good process.
It's now 8 weeks post-op and Helen is tracking well.
I'm pain-free. It's only at night it's just a bit niggly and it's hard to get to sleep sometimes. I was probably on strong pain relief for about 3 weeks and then I eased myself off. I'm on Panadol now.
Helen has been doing a half-day physio session once a week, plus daily exercise since the operation.
Physios at rehab gave me a whole lot of exercises, about 18 of them. I do them during the day. I'm feeling freer with my walking. I feel much safer and steady on my feet these days. Before I had the operation, I couldn't walk very far because of the pain in my knee, and now I can walk further. And I have been to the shopping centre and I walked around for a number of hours, so that was very tiring, but I could do it. I drive the car, I can drive the car. I was going downstairs before my operation one leg at a time because it hurt to bend it. Now I can walk down most times without having any problem.
And do you pull up okay after 30 minutes of walking?
I
You're
do,
not too sore?
but I find at night that it gets sore.
Physio April is happy with Helen's progress.
She's doing really well. I mean, for 8 weeks post-op, it's still very early in the recovery. So actually, for this point, she's doing extremely well. Her range of motion's good, her strength is good, and her walking is excellent.
Helen's rehab will continue for the best part of 12 months.
You're doing, yeah, you're walking really well.
I know.
That's excellent. So the post-operative rehabilitation, I cannot stress how important it is. The knee's not going to get better just on its own. You need to put in the hard work.
How are you?
I'm good.
Lovely to see.
It's been a long time.
Dr. Lyons is also happy, especially given Helen's knee is still healing.
I'm thrilled so far. It's not uncommon to have little niggles here and there in and around a knee replacement. You have to remember that a knee replacement, we make lots of bony cuts, and we've realigned it. So we've taken her from being bow-legged to straight. So the soft tissues do take some time just to recover and get a sense of their new normality. Certainly on all the objective markers, you're doing beautifully. The knee's coming out nice and straight. It's bending up well. The patella's tracking and it's nice and stable. So at 6 weeks, you'd expect to be okay. 3 months good. 6 months very good. 9 months excellent.
Dr. Lyons will continue to monitor Helen for the next 12 months.
Helen's future is rosy. I would anticipate that she will just continue to accelerate, get back into life with some vigour, as she's already shown.
It is now 11 weeks after Helen's operation, and thanks to her dedication to her pre- and post-op exercise programs, she has already achieved the main goals of her operation.
I'm feeling really good now. I'm doing all the exercises that I was given by my rehab, but I'm also walking 30 minutes a day, which is a lot more than I did beforehand. I could only do about 10 minutes, but I don't feel any pain when I'm walking. I do get a bit stiff when I get back, but actually it frees up and I feel much freer.
Pedal, Jack. Good boy.
I can play with the grandchildren on the bikes now, which was one of the things I wanted to do.
Which way are you going now? What a big girl you are.
And I can lift up the little one, although she's getting heavier.
Before the operation, I couldn't have done this. It just wasn't possible. Do you want to seesaw? Do you want to go on a seesaw with Jack?
I think it's changed my state of mind in that I can be more mobile, and that's really important. I've actually booked on a tour of Sydney, and I'm told that I'll be having to walk up to 5 kilometres a day, and so I'm working on that. I assured the person that's leading that I'll be able to do it, so that's what I'm going to do. I feel younger. I feel younger now that I can do all these things I couldn't do before.
Have you ever been this high before? Whoa!
This is the best thing I've done. This knee's been troubling me most of my life. I'm really glad that that's all over now, and I've got two good, strong knees, so I'm very glad.
Oh, I can't get you that high again, I don't think. Whoa!